So thanks for coming to hear about tobacco taxes. It's one of my favorite things to talk about. I'm going to try to cover a lot in the next hour or so. Just a brief overview on a lot of different issues in tobacco taxation, and then talk a little bit about the business of tobacco. So we kind of squeezed together two topics into this one session. We had a little bit less time than originally planned. We have a lot of different things that I'm going to be drawing on, so here's a few of the key publications, but there's much more. If you go to our website, tobacconomics.org, you can find a lot of this. So the World Bank's report, Curbing the Epidemic. We're going to talk a little bit about the Article 6 guidelines to the Framework Convention on Tobacco Control. Spend a bit of time on the WHO's technical manual on tobacco tax administration, which I like to think of as the best practices in tobacco taxes, and a whole lot more. I like to start with just going through why governments tax tobacco products. I always like to start with this quote. This is the one that really has defined what I've spent most of my life working on. So this is a quote from Adam Smith, 1770s, The Wealth of Nations, talking about how sugar, rum, and tobacco are commodities which are nowhere necessaries of life, which are become objects of almost universal consumption, and which are therefore extremely proper subjects of taxation. So again, almost 250 years ago, he defined what I spend my life these days working on. The main reason that governments have historically taxed tobacco is because of their revenue-generating potential. It's the same reason that they tax anything. This is a very efficient way of generating revenues. Tobacco taxes have historically been a relatively small share of price. The demand for tobacco products is somewhat less responsive to price than demand for a lot of other products. Very few producers, as I'll talk about, which makes it easy to collect the taxes. So from an economics perspective, they're a very efficient source of tobacco tax, of revenues. This is a quote from Napoleon that highlights that, talking about how this is a vice that brings in 100 million francs in taxes every year, and he would certainly forbid it at once as soon as he could find a virtue that would bring in as much revenue. So if you look around the world and just look at what's happening with tobacco taxes over time, you can see that every time governments raise their tax, they see an increase in revenues. When the tax is allowed to fall after accounting for inflation, the revenues that it generates go down. And this is a picture that shows that for the U.S. In particular. The reason that we're all here this week, though, to talk about tobacco taxes is because we know that tobacco taxes are a very effective way of promoting public health. So this is something that's become increasingly true in high-income countries, but then it's become very true in low and middle-income countries as well in recent years, in large part because of the emphasis in the Framework Convention on Tobacco Control on tobacco taxes. So in the FCTC, the first policy that really gets specifically discussed is tobacco taxation in Article 6, talking about how the parties recognize that tax and price measures are an effective and important means of reducing tobacco consumption, and that they're particularly effective in reducing tobacco use among young people. This is even further highlighted in the Empower package. I think you've probably all heard about the Empower package, which pulls out the most cost-effective policies from the Framework Convention on Tobacco Control. And this is a quote from the Director General of the WHO, talking about the Empower package, talking about how raising tobacco taxes is by far the most effective policy that we have for reducing tobacco use. So you can see this by, again, just looking at the experiences around the world. Another picture from the U.S. where we can see that as taxes and prices have gone up over time, we've seen reductions in adult smoking prevalence. You see a couple of points in there where taxes and prices stop going up for various reasons. When tax and prices stop going up, we stop seeing the declines in prevalence. Then when price starts to go up again, prevalence starts to come down. And then what you see is that within a fairly short time, you start to see the health benefits of that showing up. So here again, we see the picture in the U.S. as prices have gone up. As soon as prices start going up, consumption starts coming down. And then what we see is a few years after that, we start to see declines, for example, in early onset lung cancer, so lung cancer deaths among younger males. This is the more economics-y argument for why we like tobacco taxes. Tobacco use imposes a lot of what we call external costs, costs that are not borne by the person that's using tobacco. So things like exposure to secondhand smoke and all the health consequences that go along with that. The fact that a lot of the healthcare costs to treat the diseases caused by tobacco are paid for out of public health insurance programs. So the idea here is that tobacco taxes can then generate revenues that offset those economic costs, those external costs that are caused by tobacco use. So again, another picture for the U.S. just highlighting some of the economic costs, significant lost productivity costs as people are going to miss time from work because of illnesses caused by tobacco or die prematurely from a disease caused by tobacco. Considerable healthcare costs that are spent to treat the diseases caused by tobacco, estimated to be as much as $170 billion a year in the U.S. in recent years. But then if we look at how much is being paid for publicly, about 2/3 of those costs are paid for out of public insurance programs, costing over $100 billion a year. And then if you look at all the revenues that are generated from tobacco, there's less than $40 billion in revenues generated from tobacco taxes, from litigation settlement payments and things like that. And then the last thing that's going on is that some governments use tobacco taxes in a way that tries to promote their domestic tobacco industry, tries to keep the products of some products at least relatively low, and again, in a way that typically favors the local industry at the expense of the multinational tobacco companies. When it comes to best practices in this area, though, that's really to use tobacco tax increases as a way of promoting public health. This is what's called for, again, in the Framework Convention on Tobacco Control. And at the same time, they have the benefit of generating these additional revenues, at least in the short to medium term. When it comes to the different types of tobacco taxes, governments have a lot of options for what they can do to tax tobacco. We see different governments taking advantage of most of these different options. So some tax the value of the tobacco crop that's grown. Most governments levy some kind of import duties on the tobacco products that are being imported or tobacco leaf that's being imported. Governments that have value-added taxes or general sales taxes apply those taxes to tobacco products. But the one that we're really interested in, the one that differentiates tobacco products from other products, is going to be excise taxes, or taxes that look like excise taxes. They may have a different name, but they basically work the same way. So these are taxes that are levied on a small number of products. Tobacco tends to be one of the products that is taxed with excise taxes. And within this, there are two different types of excises that I want to highlight. One is what we call a specific excise tax. That's going to be a tax based on some measure of quantity or weight. So tax per pack of cigarettes, for example. That's in contrast to what we call an ad valorem excise tax. And an ad valorem excise tax is one that's based on value or based on price. So what we see is that governments use different types of taxes. Some use specific taxes only, some use ad valorem taxes, some use a combination of those different taxes, and then some have really complicated tax schemes where they tax the same products but different brands of that product using different types of taxes. So if we look around the world, what we see is that it pretty much breaks out into thirds. About a third of countries use specific taxes only, about a third use ad valorem taxes, about a third use a combination of the specific and ad valorem. And then we do see some countries that don't actually have excise taxes, but they rely more on their import duties. You can see that it really shakes out a little bit differently based on income levels. Tends to be the case that higher income countries rely more on specific taxes. And lower and middle income countries tend to rely more on ad valorem taxes. And then we've got the EU countries where they use a mix of ad valorem and specific to tax tobacco products. If you really want all the details, you can take a look at this when you have more time, but this sort of gives you a sense of how it breaks out in terms of the use of the different types of taxes, and then these tiered tax schemes where they have different taxes on different brands of the same products. So again, there are 31 countries that have one of these really complicated tax systems where they tax different products or different brands of the same product based on different characteristics of the product. So some do that based on price, some do it based on whether or not the cigarette has a filter, or how long cigarettes are, or how much domestic tobacco is included in the cigarette, and things like that. So those tend to be very, very complicated tax schemes. What we have learned, though, from the research that we've been doing is that it's the specific taxes that work the best. These are the ones that tend to generate higher prices for tobacco products and that end up having a bigger impact on tobacco use. So what you can see here is that the countries that rely on specific taxes tend to have higher taxes, higher prices, and governments that rely on this combination of taxes that emphasize specific more also have these higher taxes and prices. The reason that we care about that for tobacco control purposes is because it has implications for the prices that exist in the marketplace and how people can respond to changes in taxes. So what I've done here is to take the most popular brands of cigarettes that are being consumed in different countries and looked at how much variability there is in the prices of the different cigarettes that are being consumed. And what you see is that the countries that tend to have relatively simple taxes tend to see very concentrated prices, not a lot of variation between the highest price and the lowest price products. But then as you get to more and more complicated systems, you see a lot more variability in price. So what that means is that when the government decides to raise its tax, if you have one of these complicated schemes, there's opportunities for people to switch down to cheaper products in that type of system. And as a result, it's not going to have the same public health impact. It's not going to have the same revenue impact that you get from a simpler tax system. And so again, this all gets summarized in a few of WHO's best practices for tobacco taxation. Simple tax systems are going to be a lot better for public health purposes than more complicated systems. They're going to create fewer opportunities for people to switch to cheaper products in response to tax increases. They're going to reduce the opportunities for tax avoidance and tax evasion. And it's specific taxes, again, that are really going to be the key. So specific taxes, I think, send a much clearer message that all products are equally harmful. They're all being taxed the same. So they're sending that message fairly clearly instead of having different taxes on different products based on price or some other characteristic. And again, countries that rely on import duties, the recommendation is to move away from that sort of system, move towards a system where you have excise taxes, and particularly the specific excise taxes. This is all wrapped up in the guidelines that were just adopted by the Conference of the Parties last November that look at the recommendations to governments about what they should be doing with their tobacco tax systems. Talking about the importance of having relatively simple tax schemes that emphasize specific taxes over ad valorem tax systems. The other thing in this area is that we talk a lot about the importance of taxing similar products in the same way. If you don't tax the same types of products in the same way, what you end up seeing is a lot of substitution away from products that are taxed at relatively high rates towards the products that are taxed at relatively low rates. So you can see this when you look at the experiences in the EU, for example. They have very strong policies about what sort of taxes should be set on cigarettes. Not so strong policies when it comes to things like cigars and roll-your-own taxes or tobacco. So what you end up seeing is a lot of differences across countries. Relatively high taxes on cigarettes, very low taxes on things like roll-your-own tobacco, and as a result, a lot more roll-your-own tobacco use. This is a picture from the US where we had a big tax increase a few years ago and really got it wrong in a couple of ways. The government raised taxes on cigarettes, decided that it was going to raise taxes on other tobacco products to get to about the same rates as was being applied to cigarettes. But for some reason, they decided that they weren't going to do the same thing with pipe tobacco. So what we ended up seeing was that the tax on roll-your-own tobacco went up about 20 times. The tax on pipe tobacco about doubled. And people started to just switch from roll-your-own tobacco to pipe tobacco. But more importantly, the companies just started relabeling what was called roll-your-own tobacco to be pipe tobacco as a way of avoiding that tax. So there's no way of really distinguishing between the two by creating that sort of loophole. It made it easy to avoid the tax, and you can see the shift in sales. So again, this is highlighted in the Article 6 guidelines, talking about the importance of having comparable taxes on comparable products, making sure that when you raise one tax, you raise the other taxes in a similar way, so that you don't get that sort of substitution, which would then undermine the public health impacts of the tax. Again, a lot of work done over the last few decades looking at the relationships between taxes, prices, and tobacco use. When I started doing this, there were relatively few studies available. And then, by now we have hundreds of studies from all around the world. If you go back 15 years, there were 5 studies that were done for low and middle income countries. But we've now seen studies that are done in pretty much every corner of the globe. What we've learned from this research is that when you raise tobacco taxes and when prices go up, we see people who are currently using tobacco products try to quit in response to the price increases. We see former users deterred from restarting. Very effective in keeping young people from taking up tobacco use, particularly when it comes to moving beyond experimentation into becoming more regular, more addicted smokers. We see reductions in consumption among people who continue to use. And then we see some other changes in buying behaviors and brand choice and things like that in response to the tax increases. So just a few pictures to highlight all this. This is one from the UK, where the government has for a long time had a policy to try to raise taxes and prices faster than inflation, specifically to try to reduce tobacco use. And you can see that as they've raised their taxes, as they raise their prices, cigarette consumption has come down. And again, you can draw this for pretty much every jurisdiction in the world. This is for one of the states, Kansas in the US. This is for Morocco, and this one for Hungary. But you can start to see the same basic patterns. When prices are going up, tobacco use is going to go down. When prices are allowed to fall, you actually see increases in tobacco use. We estimate that about half the effect of a tax increase on tobacco use comes through getting people to stop smoking. So if you raise price by 10% in high-income countries, we estimate that there's about a 4% reduction in overall tobacco use, with about half of that, 2% of that, coming from reductions in smoking prevalence. So here's a picture for the U.S. again. One of the nice things in the U.S. from a researcher's perspective is that we have 50 different states, 50 very different tax schemes. So what we can do is start to look at things like adult prevalence versus taxes and prices in the states. And we see that the states that have the highest taxes have the lowest prevalence. The states that have the lowest taxes have the highest prevalence. And you can see the same thing if you look internationally. This is a picture for Brazil, where the government there has again tried to raise taxes over time. And as they've raised taxes, push prices up, you see the big reductions in adult prevalence that have followed that. A big part of the change in prevalence, almost all the change that we see in adult prevalence, comes from adult smokers quitting in response to the tax increases. So when you raise the tax and raise price by 10%, we estimate that about 10% of smokers are going to try to quit smoking. And that's highlighted here, looking at calls to state quit lines in the U.S. Whenever there's been big tax increases, you see a lot more smokers trying to quit. They're seeking out help to try to quit smoking. And in the end, what you find is that many of those smokers succeed in quitting in response to the tax increase. So what we're looking at here now is, again, looking at the state level information, looking at how many smokers have successfully quit smoking in response to a tax increase. And what we see is that the states that have the highest taxes have the most former smokers, many more smokers who have successfully quit smoking. A lot of the work that I've done has focused on young people, looking at tobacco use among young people. We estimate that kids are about 2 to 3 times more sensitive to price than what we see for adults. So again, the same sort of picture that we've been looking at for the U.S., where you can see that the states that have the highest taxes and prices have the lowest youth smoking rates. The states with low taxes have high youth smoking rates. And then the same sort of thing, you can see the changes over time. As taxes and prices have gone up, we've seen the reductions in youth smoking prevalence. When prices came down back at the beginning of the 90s because of a Philip Morris price cut for Marlboro, that contributed to a big rise in youth smoking at that time. And then again, you can start to see the benefits over time in terms of health. So another picture like the one I showed earlier, this one for France, with the same sort of thing. In the 90s, the government there got serious about tobacco control, started raising taxes, started raising price, ended up reducing consumption almost immediately. And then again, within a few years, you start to see the health benefits in terms of reductions in lung cancer deaths. Just a few last issues that I wanted to quickly talk about when it comes to tobacco tax principles. One of the things that we've learned is that it's important to make sure that taxes are adjusted over time to keep up with inflation. This is going to be particularly true for those specific taxes. If the taxes aren't increased, the value of the taxes gets eroded by inflation, and as a result, it starts to lose its impact in terms of public health. Something that's become more apparent, though, for low and middle income countries in particular is that it's really important to look at the affordability of tobacco products. So one thing that we see is that low income countries, we've seen big increases in income over time. So even if taxes and prices are going up, tobacco products may be becoming more affordable, and as a result, that's going to contribute to increases in tobacco use. So this is a picture for China that doesn't look a lot like those other ones that I was showing earlier. This one suggests that China saw big increases in prices, and as prices were going up, we were seeing increases in cigarette smoking, so inconsistent with the whole idea that tax and price increases somehow affect consumption. But what we noticed is that the same thing was happening with income. Income was rising very rapidly, and it was actually the case that incomes are rising faster than the increases in prices. So when we start to look at what we call affordability, look at the measure of price relative to income, what we see there is that it really tracks very well with tobacco consumption. So in countries where incomes are growing fast, it's important to keep taxes and prices rising faster than income in order to reduce tobacco use. There's only one government in the world at this point that has done this, that has adjusted its tobacco taxes to keep pace with income growth, and that's Australia. For a long time, Australia had adjusted its taxes to account for inflation. Last year, they started to adjust their taxes to account for income growth as well. And you can see that they've been able to maintain the real value of those taxes over time, and then increase taxes, increase prices with extra normal increases in the tax at different points. So again, it comes back to what's in the guidelines, talking about the importance of looking at income growth in addition to inflation, and adjusting tobacco taxes regularly to make sure that the affordability of tobacco products is going down over time. The last thing I want to talk about in this part is just the importance of using tax as one part of a comprehensive strategy to reduce tobacco use. The tax itself is going to be very effective, but when it's adopted in combination with things like comprehensive restrictions on tobacco marketing, with support for smoking cessation, you're going to see bigger effects, bigger reductions in tobacco use in response to those increases in taxes and prices. So that leads to the recommendation to take some of the revenues that governments get from their tobacco taxes and use those revenues to support comprehensive tobacco control programs. When that's going to be done, again, you're going to get bigger public health impact from the tax increase. There aren't a lot of governments at this point that do that. This is a summary of the experiences around the world. You can see that in some places there is a fair amount of activity. A lot of states in the US, for example, do that. But for the most part, governments don't use their tobacco tax revenues to support tobacco control activities or to support other health promotion, public health programs. Again, we know, though, that when they do that, it works to reduce tobacco use. This is, again, another picture for the U.S. where we've seen big changes over time in the funding for these sorts of programs. What we've seen is when states invested a lot in their tobacco control programs, we saw big reductions in youth tobacco use in particular. And then when they stopped investing in those programs, we stopped seeing the reductions in youth smoking rates. So again, this is in the guidelines. One of the most debated parts of the guidelines was the idea of earmarking tobacco tax revenues for public health programs. But at the end of the day, this was something that ended up as a recommendation of the guidelines. The last recommendation I want to talk in this area about is the recommendations about the levels of tobacco taxes. This is something that there's a lot of debate about around the world. But the WHO, in its best practices, came out with the recommendation that excise taxes should account for 70% of the retail prices for tobacco products. So this is a level that's well above where most governments are currently. If we look at what's been happening around the world, you can see that there's a pretty clear relationship between income levels and tax and price levels. So we see the highest income countries have the highest taxes, have the highest prices, have the highest share of price that's accounted for by the tax, and then that tends to fall as you move down the income spectrum. We have China isolated there just because China is the biggest tobacco consumer, has some of the lowest tobacco taxes in the world, and has some of the lowest tobacco product prices in the world. But if we look at this, you can see the taxes, including all the value-added taxes, sales taxes, things like that, don't even account for 60% of price. And if we look at excise taxes specifically, they barely account for 40% of price. So way below the recommended levels for those taxes. Again, a fair amount of variability around the world. The EU tends to have the highest taxes, the highest prices, just because of the very comprehensive tobacco tax directive that sets a very high level for governments to have to set their taxes at. In the guidelines, this was something that was a very much debated topic. It was something that the parties to the convention couldn't come to agreement on. So there are no recommendations in the guidelines about what the appropriate level of tobacco taxes should be. It's barely mentioned in the text. There's one footnote that talks about that 70% recommendation. All right, I'm going to turn from here and talk about the economic effects of tobacco tax increases. This is where I think there's a lot of confusion about how taxes affect the economy. So you hear a lot of arguments used in opposition to tobacco tax increases. People talk about how if you raise the tax and you reduce tobacco use, how could it generate more revenue? Talk about how it's going to harm the poor in particular, how it's going to put people out of work, and how it's going to lead to big black markets, a lot of illicit trade in tobacco products. So I'm going to go through these one at a time and talk about what the evidence actually shows. So again, the myth when it comes to revenues is that when you raise tobacco taxes, they're not going to generate new revenues because you're going to have reductions in tobacco use. So how can you get increases in revenues? The bottom line is that every government that has raised its tax by any significant amount has seen a big increase in revenues as a result of the tax increase. There's two things that are going on. One is that taxes account for just part of price, as I just showed you. So if you raise the tax by a lot, the price increase in proportionate terms isn't going to be as big of an increase. And then the reductions that we see in tobacco use are in a smaller proportion than what you get for the price increase. So if you raise price by 10%, we estimate about a 4% reduction in consumption in high-income countries and about a 5% reduction in consumption in low and middle-income countries. So big tax increases lead to smaller increases in price, lead to still smaller reductions in tobacco use, still significant reductions in use. And again, if you look at the experiences around the world, you see this is happening every time. So here's a picture for the UK. I talked about how they've adopted the policy of pushing taxes up over time, pushing prices up and reducing tobacco use. As they've done that, the revenues that they generate from their tax are going up. The South African government has done the same thing very effectively. They started raising taxes back in the 1990s, have steadily increased taxes over time, and as they've raised their taxes, they've continued to increase revenues despite the big reductions in tobacco use that have happened. And then the same thing has happened in Poland. I can show you country after country after country where we've seen the exact same experiences. The second argument here is that tobacco tax increases are going to be particularly harmful to the poor. This is something that gets talked about in terms of tobacco control broadly at times. The tobacco control is going to harm the poor, tobacco taxes included. The bottom line here is that it's really tobacco use that harms the poor. We know that there is this cycle where tobacco use actually contributes to causing poverty in different countries. So tobacco users divert money from household spending away from things like food and clothing and shelter to spend on tobacco products. Tobacco users are going to get sick from the diseases that are caused by tobacco. They're going to miss time at work. They're going to die prematurely. That's going to reduce the incomes that are available to the family. So you actually see tobacco use causing poverty. The other thing that we know is that tobacco use really accounts for a lot of the social inequalities in health that we see across countries. This is a little bit of a complicated graph, but the basic idea here is we're looking at the probability of dying prematurely And then looking at different socioeconomic groups, typically by tertiles, the highest income groups, the lowest income groups, and the group in the middle. And then looking at how much of that difference in the premature deaths is going to be caused by tobacco. And what we see is that tobacco accounts for about half of the difference in socioeconomic inequalities in the probability of this sort of premature mortality. So it's really tobacco that's again, harming the poor significantly. I talked about the idea that it crowds out spending on other things, that households divert spending from things that they need towards spending on tobacco products. A good study from China, for example, that looked at that, estimated that 50 million households in China were in poverty as a result of the spending that was being done on tobacco. This is some data from surveys that we do of smokers around the world, looking at smokers' responses to questions about whether or not they took money that they knew would be better spent on household essentials such as food and spent it on tobacco. You can see that it's particularly a problem in low and middle income countries where a lot of smokers report spending on things that the household really needs because they're spending on tobacco. The other part of the myth here is that tobacco tax increases are going to be harmful to the poor. The evidence that we have, though, suggests that tobacco tax increases can actually be progressive. They're going to be progressive in terms of their impact on health, because we know that the lowest income populations reduce their tobacco use by more in response to increases in taxes and prices. And because they reduce their tobacco use by more, they actually pay a relatively small share of the increases in tobacco taxes. So they get the biggest health benefits and they get the biggest reduction in spending on tobacco use. So this is a picture for Turkey, where what we did was to look at who would pay for a tax increase in Turkey. So 25% increase in tobacco taxes. And what we see is that the poor actually pay less in tax afterwards because they've cut back on consumption by the most. And the burden of the tax really ends up falling on the higher income populations. But at the same time, the poor, because of the big reductions in tobacco use, get the biggest health benefits from that tax increase. So we've done the same kind of work in other countries. This is a picture for China doing the same sort of thing. We've developed this measure that we call the health to tax ratio, looking at what share of the health benefits versus what share of the taxes are being paid. And what you see in country after country is the same basic experience. Low-income populations really benefits in terms of the health impact as a result of the tax increase. The other key thing here to keep in mind is what's happening with the revenues that are being spent from that tobacco tax increase. If the government takes some of those revenues, puts them back into efforts to really target programs to the poor, to help poor smokers quit, for example, that's going to add to the health benefits that you see. It's going to offset the concerns about the regressivity of the tax increase. So again, we've seen some governments at least do this, some governments that have earmarked some of their tobacco tax revenues for programs that specifically target the poor. All right, the next argument deals with the impact on employment. So you see this myth that if you raise tobacco taxes, that's going to be bad for the economy because it's going to put a lot of people out of work that are involved in tobacco growing and tobacco manufacturing and retailing and everything else. But the bottom line here is that the evidence that we have shows that in almost all countries, increases in tobacco taxes are going to lead to net increases in employment. Basically what we see is that in countries, even countries that are fairly dependent on tobacco, you have very few jobs that are directly dependent on tobacco growing and manufacturing. Over time, what we've seen is that in those countries, there have been big reductions in employment that have happened as a result of what the tobacco companies are doing as they've invested in new technologies for tobacco manufacturing. We've seen jobs go down there. And then what we've seen in some countries that are really concerned about the impact on employment is that when they raise their tax, they take part of the revenue and spend it on programs to help move people out of tobacco into other productive livelihoods. So we've seen that work very well in Turkey. We're seeing it work in the Philippines currently with their most recent tax increase. So the bottom line here is that when tobacco taxes are increased, you see reductions in tobacco use. That leads to some reductions in the jobs that are specific to tobacco growing, tobacco manufacturing. that the money that people were spending on tobacco products doesn't evaporate from the economy. People take the money that they were spending, they spend it on other goods and services. That creates jobs in other sectors of the economy. We see the government get those new tax revenues. They're going to spend that on other activities. That's going to put people to work in other parts of the economy. And what we end up seeing is that you get a net increase in jobs in response to those tax increases in, again, almost all countries. The last one that gets used is the idea that there's going to be a black market in tobacco. So the idea here is that when tobacco taxes go up, you're going to see a lot of illicit tobacco products. That's going to offset the benefits, the public health and the revenue benefits of the tax. The bottom line here again is that even when there is a significant black market in tobacco, when tax goes up, when price goes up, you still get the benefits of the tax increase, just not as big. This is a picture for New York. New York has some of the highest taxes in the U.S. New York, it's estimated about half the cigarettes that are consumed are evading or avoiding taxes. What we can see is that as the tax has gone up, we've seen reductions in smoking prevalence despite the presence of that black market in tobacco. Same thing in Cook County, Chicago area, where I come from. As the government's raised its tax, we've seen significant tax avoidance, tax evasion there, but still see the increases in revenues following those tax increases. Bottom line here is that there are other factors. It's not tax that drives illicit trade in tobacco. It's going to be other factors. So if we were thinking that tax and price levels drove illicit trade in tobacco, this relationship would look exactly the opposite of what we see. But what we see here is that the countries that have the highest taxes and prices actually have some of the lowest levels of illicit trade, and it's countries that have relatively low taxes and prices that actually have a lot of illicit trade in tobacco. The bottom line is that it's related more to the strength of governance in countries that have a lot of corruption, countries that don't enforce their tax laws very well, they have weak tax administration. These are the countries that have a lot of problems with illicit tobacco. So that's basically what's showing up here. Countries that are more transparent, stronger governance, less illicit trade in tobacco. Countries that have a lot of corruption have a lot of illicit trade in tobacco. There's a few other factors that are going to be relatively less important. I'll skip through in the interest of time. But we also know that there are effective ways of dealing with illicit tobacco. So Spain is a good example where they've taken a comprehensive approach to trying to get rid of illicit tobacco markets. They used to have some of the lowest taxes and prices in Western Europe, but they also had some of the biggest problems with illicit tobacco in Spain. They got serious about dealing with it, took a comprehensive approach to enforce their tax laws, to adopt new technologies to help make sure the taxes were being paid, a variety of other efforts. And they started raising taxes, and at the same time as they were doing that and really taking this comprehensive approach, they all but eliminated their illicit tobacco trade problem. So the experiences in countries like Spain and Italy and the UK and Brazil and a variety of others are what fed into the illicit trade protocol to the WHO's Framework Convention on Tobacco Control that talks about all the things that really governments can do to effectively deal with illicit tobacco trade. So when it comes to the bottom line on tobacco taxes, we know that tobacco tax increases are actually going to make really good economic sense. They're going to promote public health. They're going to generate long-term economic benefits, and they're not going to have harmful effects on the economy. So we've done some work looking at the cost effectiveness of different interventions. What we see is that tobacco taxes are by far the most cost-effective way of reducing tobacco use. All right, so I think I have about 7 minutes or so left. So we'll go through the business of tobacco even more quickly. So a couple of points, I'll just highlight a few basic points here. The tobacco industry is really evolving very rapidly if we look at what's happening around the world. There's a lot of factors. You can look at the slides and see what's going on. But at the same time, there's been this global response. We're seeing it at the conference here in terms of how tobacco control is addressing the growth in the industry. Again, the industry has grown because of a lot of different things. The freeing of trade in all goods and services has included tobacco products, tobacco leaf. We've seen it become much easier for companies to invest internationally in various countries. We've seen the privatization of a lot of the domestic tobacco monopolies. We've seen these companies all start to merge with one another. So again, a lot of different factors that have contributed to the explosion in trade that we know has led to increases in tobacco use. So the one thing I want to highlight here is just to show you how that's changed over time. We've seen this real consolidation in the industry because of these different activities. And we're now at the point where there's really 5 companies that control most of the world's tobacco markets. So very different than what it looked like 30 years or so ago. The Chinese National Tobacco Company, by far the biggest tobacco company in the world. And then you've got Philip Morris International, and I've included the U.S. branch Altria in that. British American Tobacco, Imperial Tobacco Group, and Japan Tobacco. So 4 multinational tobacco companies plus the Chinese monopoly control about 90% of the world's tobacco markets. The other phenomena that I think are really interesting to keep an eye on is the consolidation across products. We used to have in the past companies that produce cigarettes, we had companies that produce smokeless tobacco, we had companies that produce roll-your-own tobacco, and what we've seen is that tobacco companies have merged across products, so now they produce every different type of tobacco products that's available. And then I think the most fascinating thing in this whole area is that they've also started to move into other nicotine products. So this is an area where the research is really trying to catch up at this point. But there's a whole diversity of nicotine products, non-tobacco nicotine products that are on the market now. So electronic cigarettes are being produced by almost all the major multinational tobacco companies. British American Tobacco has this nicotine subsidiary called Nicoventures. They produced a product called Voke, a nicotine inhaler that they're trying to get to be marketed as a medical device. Altria, Philip Morris's branch in the U.S., has a nicotine lozenge. R.J. Reynolds in the U.S. has a nicotine gum that they're selling as a cessation product. So, the companies that are producing tobacco products are also now selling nicotine products to help tobacco users quit. There's this whole new technology called heat not burn that's just started to emerge over the last year or so, which is kind of a combination between combustible cigarettes and electronic cigarettes, where it's heating the tobacco in a similar way to generate the nicotine. And who knows where this is all going to go going forward. But again, we've gone from a place where 30 years ago was pretty much cigarettes and very little else, to now having this whole range of different tobacco products being produced by the same companies. I'm not going to go into a lot of detail on all this. I just want to jump ahead to a couple last points. I guess one point is that these companies are tremendously profitable as a result. So even with all the global tobacco control efforts that are happening, even with the tax increases that we've seen, because it is such an addictive product, they're able to raise prices beyond tax increases, raise prices in the face of tobacco control activities, and still generate considerable profits as a result. The big consequences of this, though, I think are coming with what we're seeing happen as the multinational tobacco companies take advantage of international treaties, take advantage of investment agreements between countries to really fight back against strong domestic tobacco control policies. So there's really 3 levels of challenges. So these big multinational companies, a lot of market power, very profitable, have the resources to push back against national tobacco control policies. And we're seeing that happen at 3 levels. One is happening within countries, responding in the national courts to the different types of policies that are being adopted. One example was Philip Morris a couple of years ago challenged Norway's ban on the display of tobacco products, but the Norwegian government ended up winning that dispute. More recently in the U.S., the tobacco industry challenged the adoption and implementation of graphic warning labels, and as a result, the court struck down the warning labels. So a lot of those sort of challenges happening within countries. The second class is what I call state-state disputes. These are disagreements between countries over one country's tobacco control policies. These are largely playing out in the World Trade Organization. So a couple of examples there. One was the Indonesian challenge to the U.S. ban on the sale of flavored cigarettes. Indonesia argued that that was a discriminatory policy. that it adversely affected their ability to sell clove cigarettes, Pratex, in the U.S. And Indonesia won in the WTO when it came to that challenge against the U.S. The U.S. is still trying to figure out how they're going to respond to that. The one that's, I think, of most interest globally right now is the challenges to Australia's plain packaging measures. So these were brought by 5 countries: Ukraine, Dominican Republic, I can remember all of them, Indonesia, and a couple of others. And they're challenging, again, Australia's ability to adopt a strong plain packaging measure. That's going to be heard in the WTO this June, and we'll see how that all plays out. And then perhaps the most disturbing of all these are what I call the investor-state disputes. These are the ones where companies now can challenge in international tribunals the policies that governments are adopting to deal with tobacco. So these are happening under what are called bilateral investment treaties that are negotiated between different countries. And you see the same thing happening. You see Philip Morris Asia, I should say, challenging the Australian plain packaging measures under a bilateral investment treaty between Hong Kong and Australia. You see Philip Morris International doing it with Uruguay over some of their policies in response, or under a similar treaty between Switzerland and Uruguay. So we don't know how these are all going to play out, but I think it really is something that's delayed the adoption of strong tobacco control policies in a number of countries around the world. Something that's really hard in low-income countries in particular, where they don't have the resources to fight back against the multinational tobacco companies. Just a couple of other things. When it comes to the new products, these are being developed and marketed as ways of getting around existing tobacco control policies. So a lot of the electronic products, for example, are not going to be covered under smoke-free policies. A lot of government's definitions of tobacco products mean that a lot of these products are not subject to things like marketing restrictions. So there are ways for these products to really undermine what's happened with tobacco control. And you see that in a lot of the advertising that's happening. In addition, these products really pose significant challenges for regulators. They don't know what to do with them at this point. Everybody's still trying to figure that out. And you'll see a lot of discussion about that at the conference this week. So I tried to cram way too much into the short amount of time that we have. But basically what we know is that tobacco taxes are very effective in reducing tobacco use, that the globalization of the tobacco industry is raising new challenges for tobacco control. And if you want to find out more about all this, you can visit our websites, and you can follow us on Twitter, and you can email me, and we can talk more at some point during the week while you're all here. So sorry for not being able to do that a little bit more efficiently, but hopefully it was